am medical diagnosis. I am used for the identification of a disease condition based on a specific evaluation of physical signs, symptoms, a patient's medical history, and the results of diagnostic tests and procedures. Physicians are more likely to use me.
I'm nursing diagnosis. Use me when the problem the patient is experiencing for the first time. This statement usually is ever-changing, such as anxiety, acute pain. You can look at more examples of me on 228 and 229. Nursing diagnosis example. The example is deficient knowledge. This is the diagnosis problem that they're experiencing. And then this is what's causing it, misinterpretation of information. And then as evidence-based would be an accurate return demonstration of self-injection. And this is the actual thing patient is doing that demonstrates proof of the problem.
I am the North American Nursing Diagnosis Association International, NANDA. I contain several hundred diagnoses and continue to grow on the basis of nursing research. A nursing diagnosis is used to determine the appropriate care for the patient. The nursing diagnosis drives the interventions and patient outcomes, enabling the nurse to develop the patient care plan.
These are the 3 types of nursing diagnoses.
I'm a problem-focused nursing diagnosis. I describe a clinical judgment concerning an undesirable human response to a health condition or life process that exists in an individual, a family, or community.
Yo, it's the risk diagnosis. It's a clinical judgment concerning the vulnerability of an individual, family, group, or community for developing an undesirable health condition. These are the risk factors.
I am a health promotion nursing diagnosis. I am a clinical judgment concerning a patient's motivation and desire to increase well-being and actualize human health potential. You need to use me when patients are in any health state that expresses a readiness to enhance specific health behaviors.
We are now going to explain the 4 different nursing diagnostic processes.
Oh, hi, I didn't see you there.
Hey there.
Analysis and interpretation of assessment data begin by organizing all of the patient's data into meaningful and usable data clustering.
Has anyone seen where data clustering is? I can't interpret without them. I guess I'll just begin. Data interpretation. This is where you look at all the clues and interpret what you observe through NANDA to figure out what's wrong on 231.
Now that data clustering is here and data interpretation just went, I am able to formulate a nursing diagnostic statement. The aim is to select the correct diagnostic statement. If you make an incorrect nursing diagnosis, the patient is likely to receive inappropriate or unnecessary care. It's important for a nurse to review the diagnostic label. The diagnostic label is the name of the nursing diagnosis that is approved by NANDA. It describes the essence of the patient's response to a health condition in as few words as possible. They all have a definition which discusses the characteristics of the human response identified and helps to select the correct diagnosis. A complete diagnostic statement will also include a related factor which you gather from a patient's assessment data. The related factor is associated with a patient's actual or potential response to a health problem and can change with interventions. Related factors for NANDA include 4 categories, which are pathophysiological, treatment-related, situation, and maturational. When communicating a nurse's diagnosis, make sure you follow the language adopted by the agency. Most settings use a 2-part format, which includes the NANDA diagnostic label, followed by a statement of a related factor. The 2-part format provides a diagnostic's meaning and relevance for a particular patient. A 3-part nursing diagnosis is also used, but are less common. To write a 3-part nursing diagnosis, use the acronym PES, which stands for Problem, Etiology, and Symptoms, or Defining Characteristics.
Cultural relevance is important because when you're selecting a nursing diagnosis, you need to consider your patient's cultural diversity. This includes their values, beliefs, health practices, ethnicity, and gender. This means you need to know the cultural differences that may affect how the patient defines health and illness and what they may or may not choose for treatment. To make culturally competent nursing diagnoses, you should always ask questions such as, what worries you the most about your problem? How has this problem affected you and your family? What do you believe will help or fix the problem? Asking these type of questions allow you to see the patient's health problem through their eyes.
What are errors in the data collection? Number 1, lack of knowledge or skill. 2, inaccurate data. 3, missing data. 4, disorganization. 5, failure to validate. That's a big no-no.
You also don't want errors in your interpretation and analysis of data. Make sure you review your database to decide if it is accurate and complete. You can compare your objective data to make sure that it supports your subjective data. If you're unable to validate any data, it means that there's an error. You can also look at your conflicting or insufficient cues.
Errors that occur in data clustering include insufficient cluster of cues, premature or early closure, and incorrect clustering.
Errors in diagnostic statement. Selecting the correct nursing diagnosis is very crucial to patients' outcomes. To reduce errors, make sure you're selecting appropriate, concise, and precise language using NANDA terminology. There are 12 more additional guidelines listed on page 235 and 236 to give you an idea more in depth how to reduce all these errors.